It's time now for County-Wide, a presentation of Yavapai Broadcasting News. You'll hear about the interesting issues and happenings that affect all our lives. Here's today's County-Wide.
Well, a good day and welcome to you. Welcome to the show. I'm Brad Miller with County-Wide. Happy to welcome into our studio a guest. Stephen Everett is an epidemiologist with the Yavapai County Community Health Services. And today we are going to talk about everybody's favorite holiday theme, immunizations and vaccines, and why you should get yourself prepared for the coming flu season. And Stephen, thank you for coming and
my pleasure.
Visiting with us today. I know it's a busy time of year for everybody, and your department certainly is gearing up for flu season. And we're going to talk about flu vaccines. We're going to talk a little bit about COVID today, perhaps RSV, which we seem to be hearing a tiny bit more about in recent years. But let's just kind of start, first of all, flu season. Why is it in wintertime? How long does it last? And why do I need to get myself protected?
Yeah, well, flu season is mostly in the winter and spring. Yeah. You can get flu in the summer, but it's fairly rare. Yeah. But it's mainly because people are indoors more. It's
not because it's cold out.
Not really. I mean, it has some effect, just with your sinuses getting dried out from the cold.
Makes sense.
But mostly it's because everyone's inside.
Okay. You're huddled together.
Much easier to spread.
Well, there you go.
Yes.
That makes sense. Now, when we talk about vaccines, what is it? We remember there was some years ago where there was a vaccine that wasn't quite appropriate for what was predicted to be the strains. I'm talking your language here now, or trying to, but you know where I'm going. That
yes.
The vaccines, it's not just one catch-all. We've got to know what's kind of coming or expected.
Right, because the way the vaccines used to be grown were in eggs, and it takes about 6 months to develop it. So what the World Health Organization does is look at what's going on in the Southern Hemisphere, because their seasons are different from ours. Our summer is their winter. And they look to see what strains are circulating around there, and then they predict which ones will be coming up here.
Okay.
But with newer technology, it gives them a little more time, so they should be more accurate. But the flu is always mutating, and so it's hard to always nail down perfectly what it's going to be.
Right. But generally speaking, then, we'll have a vaccine that is going to be 90% effective, 88% effective, or whatever the case may be, as those predictions either shift a little bit or come in right on the money.
Yes.
Okay.
It's rarely 100% just because there's so many. Actually, when you get the flu vaccine, there's actually 3 different flu strains that it immunizes you against.
Okay. Well, okay. All right. You guys have thought of things.
Yes.
You're way ahead of me. That's why people like you are in charge of these programs. I don't like to get a shot. It hurts. I don't want to do it. I don't have the time. I don't have the blah, blah, blah. All of those arguments you would counter with what kind of reasoning?
It's easier than getting the disease. It's pretty much, if you want to lay in bed for a few days, headache, chills, absolutely miserable. But with a shot, it takes care of all that. You might have some small effects. You might have like a slight fever, some slight achiness. That is actually a good thing.
From the shot, you're saying?
Yes.
Yeah.
That means that your body's responding to it. And
okay.
So what the vaccine does, it kind of tricks your body into thinking you have the disease.
Yeah.
And so it'll build up your antibodies. So when you're exposed to the disease, you already have the antibodies in your system to fight off the infection.
Okay. Kind of like a practice.
Yes.
Kind of like a preseason for the battle against
it's like a boxing
illness.
match where you go in the ring with a sparring partner and you spar, and then when the real thing comes along, you're going to be in a lot better shape.
You're going to be prepared for it. Okay.
Yeah.
So the vaccines will last. It's flu season. We think that lasts around here until at least through February, maybe March.
March to April.
Okay, so
usually
now is a really good time to get.
Absolutely, this will protect you. If you get it in the next few days, you'll be fully protected for Christmas.
Okay,
it takes about 2 weeks for it to reach its full effectiveness. So a lot of people say, I got the flu shot, then I got the flu.
Right,
that's entirely possible.
Yeah. Why? No,
because let's say if you get the shot and then tomorrow you're exposed to someone with the flu, the vaccine hasn't had enough time to develop the antibody.
It's ahead in the race to make you feel lousy or better.
Exactly.
Okay.
Exactly. But you cannot get flu from the flu shot.
Right.
It's you don't even get injected with the actual virus. It's actually the virus chopped up pretty much. Essentially what they do is they put it like a giant blender and they break it all up. So it's just the tiny little bits. That's all they need to cause the reaction to develop antibodies.
Kind of the active ingredient.
Yes.
Of the thing. Okay. So it's going to last me about 6 months. So I should get a second one after 6 months, or
usually you only have to get one a year.
Yeah.
But if you do have respiratory issues or immunosuppressed issues, talk to your doctor. He may recommend a second shot.
Okay.
Or if he thinks that you got it too early.
Okay.
And the season started late.
Okay. We think about our most vulnerable populations, the very young and the very old, or
Yes.
folks who have, other illnesses alongside on board. And so those. I'm just curious, and I know you don't necessarily have numbers in front of you, but how is our flu immunization a percentage, say, in Yavapai County or this part of the state?
That I am not sure. It's always, the records are usually a couple weeks behind.
Yeah.
So it's hard to say. But usually the senior population is much better than
They
young
just
adults
know.
and working adults.
Nothing can hurt a young person. I don't have time and I don't need it.
Exactly. And then they get sick and
well, and it
miserable.
seems like there, and I do want to ask you about COVID, but that was one of the things that I know health agencies across the world were trying to impart was, you might be able to knock this off on your own, young, healthy, strong people, but it's grandma that we're concerned about. Even if it's not your grandma, it's maybe the grandma of your coworker. And that message went for a while to some, and to others it was just kind of knocked down. Is that, again, the same kind of thing with flu? And we can kind of talk about COVID, too, because I know you're recommending COVID shots at this time.
Absolutely.
Okay.
You're not only protecting yourself, you're protecting others.
Yeah.
What I always say is, when you're sick, stay home. Don't go into work, because you go into work, you're going to get everyone else sick, and then you're going to have to cover for them.
Right.
So it's a much more situation than actually getting the flu.
You're bringing a lot of practical reasons to
Exactly.
this. And why not? Well, it's true. We chuckle, but it's absolutely true. It's just, if you think of it as something you could see, if it was like a little tiny wildfire that it followed a little path of flame behind everybody who had the flu, it would start to light all the other deaths on fire after a time.
Exactly.
And so we make a little bit of a joke, but it's kind of how it works.
Yes.
Yeah.
Yes.
Okay. So we talk about flu vaccines. I'm going to go out. I'm going to get mine right away. It might feel a little bit punky after I get it, but then I'm going to be good, most likely through the holiday season, certainly, and probably well beyond that, well into the spring. COVID, we're tired of hearing. Let's do this. Let's take a break.
Okay.
When we come back, I do want to talk about COVID. It's everybody's least favorite subject.
Oh, yes.
But we need to, because it's still a thing. And it's still happening in Yavapai County. Our guest is Stephen Everett, Community Health Services with Yavapai County. He's an epidemiologist. He knows how these things work. And we'll talk more with Stephen Everett after this. We're back with Countywide.
Life changes, then it changes again. Predicting the unexpected in life is impossible. That's why it's called unexpected. So when it comes to financial goals, our philosophy is don't predict, prepare. Hi, I'm Edward Jones financial advisor Matthias Sandoval. A job loss, change in health, or a loss of a loved one can have a big impact on your family's financial security. Let's work together to help make sure you're equipped for life's unexpected events. Call our office to schedule a face-to-face appointment.
Edward Jones, making sense of investing. Member SIPC.
Verde Solaire, your hometown heating, air conditioning, and plumbing company in the Verde Valley. And your trusted North Central Arizona Goodman dealer. Goodman is a name you can trust with the revolutionary Comfort Bridge technology, factory installed into select Goodman gas furnaces and air handlers to ensure the entire system operates at peak energy efficient performance. Verde Solaire offers free in-home estimates, locally owned and operated since 1983. Visit them at verdesolaire.com. Better, cleaner, faster.
Thank you so very much for your generosity and kindness in helping others. I hope that you take advantage of the many Arizona state tax credits available when giving to qualified charities and schools. If you haven't taken advantage, I hope you'll ask your favorite charity if they qualify. You can go to Arizona Department of Revenue website, search for tax credits, and look at the list of qualifying charities. Then look at your latest Arizona income tax return and see how an Arizona tax credit can benefit many. This is Lewis saying thanks again.
Let's talk. That's the message from Jonna Randall Murdoch, your local Farm Bureau agent, providing a personal touch when making insurance and financial decisions. Jonna will simplify your insurance needs while offering competitive pricing. Let's talk auto, home, life, and farm. Call Jonna at Farm Bureau today at 928-649-8686. Your Cottonwood Farm Bureau Property and Casualty Insurance Company. At Farm Bureau, they insure more than just farms.
We welcome you back to the program. Again, it's Countywide. I'm Brad Miller. Stephen Everett is the epidemiologist with the Yavapai County Community Health Services, and we are talking about vaccines. Our first piece, talking about it's flu season right now, and will be well into the new year, and you can be protected, especially if you are among our vulnerable populations, older, younger, pre-existing conditions, respiratory, things like that. Please do consider very strongly getting this flu vaccination. Talk to your doctor about that, and there's a ton of places that these can be given: grocery stores, pharmacies.
Absolutely,
there's no shortage in people who will help you out with that. So let's talk about everybody's least favorite thing: COVID. It's still a thing.
Yes, it is.
You would recommend a COVID vaccine?
Absolutely.
Okay, as part of either an ongoing cycle. When those of us who live through it, and that's most of us who are able to listen to this show. We'll remember when it came out and we got it, and then another, what was it, 3 months or 6 that we recommended the second of the series?
That was at the beginning.
At the beginning, yeah.
If you've already had, now it's just booster shots.
Okay.
So we do recommend it every year because much like the flu, COVID changes over time.
Okay.
So you need to get protected against the new versions.
Okay.
The old shots will give you some protection, but not full protection. It depends on how well they match up to the strain that you were exposed to.
And COVID's endemic. It's part of our lives now and probably for forever. Yeah, this happens. How is, here again, I'm going to bounce back to a question I asked you earlier, and I know you don't have numbers in front of you. Mm-hmm. Any idea how our vaccination rate in Yavapai County is for COVID?
Last time I looked, it was about 70%.
7 and 10 seems pretty good to me.
That is pretty good.
Yeah.
So, and it's mostly seniors. I think a lot of it has to do because we have a large senior population in Yavapai County.
Well, sure.
So that kind of skews it up a little bit.
And does help. And
yes.
Here again, there was a lot of political backlash, which I never have understood. But again, a lot of times with younger, healthier people, it's not as much of a threat. And that's true.
Correct.
So you can't tell them they're wrong there. But again, it's about protecting people around you.
Exactly.
Is really kind of the biggest thing. Do we have cases? Are we having outbreaks? Or
we're not having outbreaks so much. It's been pretty flat for the last 2 years.
Good.
So we're averaging, right now we're about 15 cases a day.
Okay.
Which doesn't seem much, but that still makes it the most contagious disease going around in the country right now.
Really?
Yes.
15 in Yavapai County per day?
Yes, 15 in Yavapai County.
Okay. Well, in a population of roughly 250,000, that's significant.
Yes.
And if it goes from there, are these what? How are the outcomes? Are these typically hospitalizations or treated at home?
Mostly treated at home.
Okay.
Some hospitalization deaths are down a lot.
Yeah.
Which is great.
Yeah.
But so it's mainly, and of course we're not seeing, since they have home kits now for testing, we don't get those reports.
Right.
So it is actually higher.
Right.
And then of course, people with milder diseases, they don't know they have it, they just think it's a cold.
Right.
Still 15's good.
Here's an argument I've heard, we've all heard, I'm sure you've heard it too. I got the COVID vaccine and I still got COVID. I did. I got vaccinated according to what my doctor told me to do.
Yes.
I'm a heavy guy. I'm not a spring chicken, but I'm not, so I did.
Yeah.
And I got COVID and I felt kind of punky for about a day and then it was done.
Yes.
Is that because I got the vaccine?
Yes.
Yeah?
You can get reaction from the vaccine.
Like any.
Yep. And that's totally normal. That's your body responding. So that's showing that the vaccine is being effective.
Okay.
You do have to have little symptoms, kind of achy, might be a bit of fever, but, it's one day of slight illness versus, quite a few days of a heavy illness.
Yeah.
If you're unfortunate.
When I first got it, it was really when there was still, we were within the first year of it. It was 2021, early, like January.
Yep.
And I could, by the hour, I could feel it coming. And I was scared. I was like, okay, is this going to be a thing? And it kind of bottomed off with a fever, say 6 p.m. or so. And I'd had the initial shot and the first booster at that point. My time frame that I'm saying may not quite be right, but that's where I was in the scheme of how the vaccines were administered to me anyway.
Right.
And then I woke up the next day and I felt okay. I didn't come to work because we still had the protocols at that time. And then I felt like I was out of it. And I completely attributed that to the vaccine.
Yeah.
I really did. Do you want to even address some of these things, Bill Gates and those kinds of things, from your learned perspective, the experience that you've got? Is that just media? Is that social media?
Just media misinformation.
You've seen nothing
exactly.
Suggest
you have millions of doctors all over the world, that went into medicine to help people. Why would they try to poison people?
Yeah.
So, people do have reactions to the vaccine.
Right.
That's not something we try to keep a secret at all. For flu, it was used to be made in eggs. So if people with egg allergies,
right,
they can't get it. If you have an allergic reaction, that's why the nurses have you stay for about 10 minutes because they can give you a shot
right,
of epinephrine in case you start getting an allergic reaction.
Okay.
But yeah, we don't want people to get sick, and we don't want people to die.
And these are recommended. You mentioned egg twice in our program, and it leads me this bird flu we're hearing a little bit about right now.
Oh, yes, bird flu.
Do you want to talk about that? Is that a coming thing? Do I need to be worried about that?
It's hard to say. There's two camps, essentially, between epidemiologists. There's the camp that says it's been circulating around for 20 years now. It's only a matter of time. And then there's the other camp that says it's been circulating around for 20 years ago. It would have happened already.
Meaning the jump to people.
To jump to people.
Okay.
So it can jump to people, but they have to have really close exposure. We would be essentially chicken farmers would be the most at risk. And the very rare that it jumps from person to person. It's like almost never. I think there's only been a few documented cases where it goes person to person.
Okay, so if a chicken farmer, say, got it, it's unlikely he would give it to Mrs. Chicken Farmer.
Correct.
Okay, well, that's good. It seems like that might be the strongest containment element of the whole darn deal.
Yes.
Is there a bird flu vaccine for those who might worry about? Can Mr. Chicken Farmer get a vaccine today?
No, I do not. They probably could make one, but just the economy of it, there's so few chicken farmers.
Okay.
It wouldn't be feasible. But with the technology now for making vaccines, if we do get a flu virus, we should have a vaccine fairly quickly.
Okay. Is there something on the horizon that you see is coming along? That
not so far.
Right.
There was that Marburg virus outbreak in Rwanda. Marburg is like Ebola.
Ooh.
Where it's really nasty, high mortality rate.
Right.
But that's been, they think they got that under control. There's no more travel advisories, which is good. There's another weird one in Democratic Republic of Congo that they don't know a lot about. I mean, it's only the very first initial things. They haven't even narrowed down what the virus is.
Okay.
Then
certainly nothing for us to get upset about.
No, not yet, at least. Okay. And the only other one going around is monkeypox, and that's it's usually sexually transmitted. So you want to, as long as you use proper protection, you should be okay with that.
Okay. And do we get the monkeys to use proper protection? Or is that simply a name? I'm going for laughs to try to lighten a little bit of the load here. I don't know why.
I think they're fairly safe in the zoo. They don't get that exposure.
Yes, there you go. The best thing. One other beast I want to ask. We seem to hear a little bit more about RSV, the respiratory ailment.
Yes, RSV.
In recent years. Is there a vaccine for that? Is that something that the general population needs to be concerned about?
There is a vaccine. It's mostly for the elderly. So 75 and older, it's recommended.
Okay.
And if you're younger and your doctor recommends it, if you have like respiratory issues or immunosuppressed, check with your doctor.
RSV means
respiratory syncytial virus.
Okay, so it's a breathing.
Yes, it's another respiratory illness.
Okay.
And then the only other group would be your infants.
Okay.
we recommend it for.
Okay. Makes all of these things make sense to me. All right. We'll take another break. When we come back, we'll wrap up and give you some information about how to contact the health department, some closure about just how you can reach out, be proactive. Flu season is here. COVID season's always here. You want to be protected, especially as we head into the busy holiday time. Stephen Everett is our guest epidemiologist with the Yavapai County Community Health Services. I'm Brad Miller, and Countywide back right after this.
Life changes, then it changes again. Predicting the unexpected in life is impossible. That's why it's called unexpected. So when it comes to financial goals, our philosophy is don't predict, prepare. Hi, I'm Edward Jones financial advisor Matthias Sandoval. A job loss, change in health, or a loss of a loved one can have a big impact on your family's financial security. Let's work together to help make sure you're equipped for life's unexpected events. Call our office to schedule a face-to-face appointment.
Edward Jones, making sense of investing. Member SIPC.
Verde Solaire, your hometown heating, air conditioning, and plumbing company in the Verde Valley, and your trusted North Central Arizona Goodman dealer. Goodman is a name you can trust with the revolutionary Comfort Bridge technology factory installed into select Goodman gas furnaces and air handlers to ensure the entire system operates at peak energy efficient performance. Verde Solaire offers free in-home estimates, locally owned and operated since 1983. Visit them at verdesolaire.com. Better, cleaner, faster.
Thank you so very much for your generosity and kindness in helping others. I hope that you take advantage of the many Arizona state tax credits available when giving to qualified charities and schools. If you haven't taken advantage, I hope you'll ask your favorite charity if they qualify. You can go to Arizona Department of Revenue website, search for tax credits, and look at the list of qualifying charities. Then look at your latest Arizona income tax return and see how an Arizona tax credit can benefit many. This is Lewis saying thanks again.
Let's talk. That's the message from Jonna Randall Murdoch, your local Farm Bureau agent, providing a personal touch when making insurance and financial decisions. Jonna will simplify your insurance needs while offering competitive pricing. Let's talk auto, home, life, and farm. Call Jonna at Farm Bureau today at 928-649-8686. Your Cottonwood Farm Bureau property and casualty insurance company. At Farm Bureau, they insure more than just farms.
Welcome back to the program as we wrap up Countywide with Stephen Everett, epidemiologist, Community Health Services in Yavapai County. And I know, like we mentioned earlier in the show, grocery stores that have pharmacies and standalone pharmacies, CVS and whatnot, they're doing vaccinations. The county certainly is. Are there clinics? Do I go to my own doctor? And people are going to want low-cost vaccines too.
Right. Usually insurance will cover it.
Okay.
So they tend to be free.
Okay.
You can make an appointment at the health department. That number is 771-3122.
Okay.
Or the major pharmacies all have pharmacists who can give the shots. Your doctor's offices, some may not have it, but check. Maybe they do.
Yeah.
Just because there's so many other places that give it, they might be cutting back a little bit. But yeah, there shouldn't be any problem getting a vaccine.
Okay. Talk to your doctor, if nothing else, and make sure that you are protected. The holiday time is coming. Flu season really reaches its peak between now and about the end of February or so. You want to be ready for it when it is here. You're going to be getting together with family and friends, and you want to do that in a safe manner. And you want to keep family and friends and grandma and everybody safe, content, happy, healthy throughout the holiday season and into the new year. We appreciate Dr. Stephen Everett, not a doctor. I just gave you promotion. Epidemiologist with Yavapai County Community Health Services. Thank you for the work that you do, that the department and the agency do.
Oh, my pleasure.
And we appreciate you being our guest today on Countywide. I'm Brad Miller. We'll see you next time.
This has been Countywide. Listen in each Tuesday and Thursday at this time. If you have a topic or guest idea that you'd like to suggest, email us, news@myradioplace.com.